Very interesting patient last week who had previously wanted to try PAP therapy for their sleep apnea, but never really made much progress. When they came back last week to talk with me, his approach was, I really want to do this because I really want to eliminate my snoring, and I know that that's going to make my wife happy, and that's why I'm doing it. So we had a long talk after that, and the reason we had a long talk was I wanted him to know that his chances of using PAP therapy long term were actually very low because his motivation was not internal or central to himself, but rather it was attempting to please someone else. Now, it'd be great if somebody could use the device, feel like they were doing it maybe to please a family member, but then what we would hope for is that that individual would get some type of benefit. The benefit might be, decreased daytime fatigue or sleepiness. The benefit could be improvement in control of blood pressure, less trips to the bathroom at night. In this particular case, we actually spent most of the time in the interview discussing how he did not think he had any sleep problems whatsoever. He could not see that any of these things applied. He didn't have hypertension. He didn't wake up to urinate. As far as he was concerned, he did not think that he had daytime fatigue and sleepiness. So as we concluded it, we realized that he was still motivated to go forward, but we were going to pay special attention to trying to understand whether or not perhaps he did have a symptom that he didn't realize. And in particular, we talked about the fact that there are certain types of individuals that work very hard in their daily life, and they literally don't sit down. They don't have time to sit down, and it's as if they wouldn't have time to notice if they were suffering from daytime fatigue and sleepiness. And we had a lengthy discussion about this particular process, and he's now going to pay attention to the fact, because in our clinical experience, some of these patients will use the PAP therapy device, and then several months later, they will tell us they finally realized they in fact were more tired and sleepy than they thought, and now by using the device, they actually have more energy. That's what we're hoping for this gentleman, because in our clinical experience, when a person only uses the device to please somebody else, there's a much greater risk that sooner or later they're going to stop using the device, which is probably not the best thing, especially if the patient is older and eventually develops some type of cardiac risk factors for which using the PAP therapy device may help them reduce those risk factors.